Longevity science has entered a pivotal era, transitioning from observational studies of long-lived individuals and animal models into experimental therapeutics aimed at extending human health span. The idea that aging is a modifiable biological process, rather than an immutable consequence of time, is now widely accepted in the biomedical community. This conceptual shift has galvanized clinical research into interventions that not only delay age-related diseases, but also target the underlying mechanisms of aging itself. From pharmacological compounds and microbial therapies to gene and epigenetic editing, a growing pipeline of translational efforts is reshaping the frontier between basic geroscience and real-world human application. Among the most advanced anti-aging candidates, now moving from bench to bedside, are geroprotective drugs, compounds that slow or reverse biological aging processes. Metformin, a decades-old diabetes drug, is at the forefront of this movement. The Targeting Aging with Metformin (TAME) trial, a large, multi-center study planned in the United States, aims to assess whether metformin can delay the onset of multiple age-related diseases in non-diabetic older adults. Unlike typical drug trials focused on a single condition, TAME is designed to test the multimorbidity hypothesis that targeting aging pathways may simultaneously reduce the incidence of cardiovascular disease, cancer, cognitive decline, and frailty. Metformin's appeal lies in its broad mechanisms. It improves insulin sensitivity, reduces inflammation, and activates AMPK signaling, all of which intersect with known longevity pathways. Another compound of intense interest is rapamycin, an mTOR inhibitor originally developed as an immunosuppressant. mTOR, mechanistic target of rapamycin, is a nutrient-sensing pathway that modulates cell growth and autophagy. Its inhibition has repeatedly extended lifespan in animal models. Small human trials of rapamycin and its analogs, rapalogs, have shown promising results, including improved immune response to vaccination in older adults and potential cognitive benefits. Larger and longer trials are currently being designed, with some focused on assessing rapamycin's impact on immune aging, kidney function, and cardiovascular health. Emerging alongside these pharmacological approaches are efforts to modify the gut microbiome, a complex ecosystem that plays a central role in immunity, metabolism, and inflammation. Studies in model organisms have demonstrated that youthful or diverse microbial populations can extend lifespan and improve health markers. In humans, fecal microbiota transplants, FMTs, have already shown efficacy in treating recurrent Clostridioides difficile infections, and exploratory trials are now evaluating their use for age-associated conditions such as frailty, cognitive impairment, and systemic inflammation. While the safety and standardization of FMTs for aging remain active areas of investigation, next-generation approaches such as defined microbial consortia and postbiotic metabolites may offer a more targeted and reproducible means of harnessing the microbiome for longevity. Perhaps the most ambitious translational frontier is epigenetic reprogramming, the process of resetting a cell's epigenetic marks to a more youthful state without erasing its identity. This concept builds on the discovery that somatic cells can be reverted to pluripotent stem cells using factors like October 4th, SOX2, KLF4, and c-MYC/OS/GAM. In mouse models, transient expression of these factors has been shown to rejuvenate tissues, improve regenerative capacity, and extend lifespan, without causing uncontrolled cell proliferation or tumorigenesis. Early-stage human research is now exploring whether similar interventions can be safely applied in vivo. Companies and academic groups are developing partial reprogramming techniques to restore youthful epigenetic patterns in specific tissues, such as the retina, muscle, or brain. While still in preclinical stages, these strategies represent a fundamental leap. Rather than treating aging symptoms, they aim to reverse its molecular root causes. Other promising avenues include senolytics, drugs that selectively eliminate senescent cells, which accumulate with age and secrete harmful pro-inflammatory factors. Clinical trials of senolytic agents like dasatinib and quercetin have already begun in populations with idiopathic pulmonary fibrosis, diabetic kidney disease, and osteoarthritis. Initial results suggest that targeting cellular senescence can reduce inflammation and improve physical function, even in late life. As more refined and tissue-specific senolytics are developed, their integration into routine geriatric care may become feasible. At a systems level, many of these interventions are being evaluated not only for their clinical endpoints, but also for their ability to shift biological age markers. The increasing use of DNA methylation clocks, proteomic profiles, and metabolic signatures in trials allows researchers to assess whether therapies are not just alleviating disease, but truly slowing the pace of aging. This convergence of molecular diagnostics and geroprotective therapeutics is expected to accelerate the feedback loop between research and application. Importantly, translating longevity science into clinical practice also requires rigorous attention to safety, ethics, and population diversity. Anti-aging interventions, particularly those involving gene or epigenetic modification, must be scrutinized for off-target effects, long-term consequences, and equitable access. The field must also grapple with the challenge of designing trials that capture the complex, multifactorial nature of aging. Unlike single disease studies, longevity trials must account for broad-spectrum benefits, extended timescales, and heterogeneous participant profiles. Adaptive trial designs, digital health monitoring, and real-world data integration will be key to meeting these demands. In parallel, a growing ecosystem of regulatory, academic, and commercial initiatives is working to build the infrastructure needed for longevity therapeutics. The FDA is increasingly receptive to aging-related endpoints, and international consortia are establishing aging biomarker databases and biobanks to support translational efforts. Meanwhile, investment in longevity biotech has surged, drawing attention not only from scientists and clinicians but from policymakers and the public. In conclusion, the journey from bench to bedside in longevity science is no longer speculative. It is actively unfolding. While many of the most radical interventions remain in early development, the first generation of anti-aging therapies is entering clinical trials, offering a glimpse of what a future of extended health span could look like. If successful, these efforts may shift the paradigm of medicine from reactive disease management to proactive aging modification, transforming the arc of human health in the 21st century.